Hello everyone. In this video, we are going to see day 11 of our 15 days timetable. The important points from day 11 will be covered. Day 11 includes 3 topics from perio and 3 topics from pedo. The topics from perio includes periodontal pocket, gingival enlargement, patterns of bone loss, furcation and osseous surgery, and implants. Implants you have to cover from both perio point of view and prosto point of view and little bit from oral surgery point of view. From pedo, the 3 topics include child psychology, caries and restorative dentistry, and diseases of child. First one, periodontal pocket and gingival enlargement. So under that, you have to go through the grades of gingival enlargement, the classification of gingival enlargement, especially the drug-induced gingival enlargement. You should know all the drugs name and the alternate drugs. What is clinical attachment loss? So under clinical attachment loss, you should know the difference between a recession and a pocket and what you term it as clinical attachment loss, and the different types of periodontal pocket, then infrabony and suprabony pocket measurements, the generations of probe, different generations of periodontal probe is there. So you have to know the names of examples of different probe names under different generation. From image based MCQ point of view, you should know how a neighbor's probe looks like, how a WHO probe looks like, and how Williams periodontal probe looks like. Next topic is patterns of bone loss and furcation and osseous surgery. So under that, you have to know the different types of wall defect, what is buttressing bone formation, what is hemiseptum, trauma from occlusion, prognosis of periodontally compromised tooth, grades of furcation and the management of furcation for different grades, what are the stages of osseous surgery, what is guided tissue regeneration technique, the different types of graft, the wall defect and the osseous surgery performed for different wall defects, what is positive architecture and what is negative architecture, the difference between osteogenic, osteoinductive and osteoconductive. Next topic is dental implants. So under that, you should know the different types of dental implants and the components of them, the minimum distance between a dental implant and the vital structures like nerve, inter-implant distance, distance between an implant and the root, like that you have to know the distance between an implant and the vital structure, the indication and contraindication of implant, and also you should know from image based MCQ point of view the special implants, how they look like, the zygoma implant and pterygoid implant, and what is peri-implantitis. Next topic is child psychology. So under that, you should know the Frankel behavior rating scale, nitrous oxide sedation, sedation in children, Freud's theory of stages of development, then non-pharmacological behavior management. So under that, you have behavioral modification and behavioral management, everything you should know, the names of each. And under the pharmacological management, you should know the names of different types of sedation we will be using. And lastly, the Piaget cognitive theory and psychosocial theory. What are the different stages under the theory? Next topic is caries and restorative dentistry. So under that, you should know what is early childhood caries and what are the types of early childhood caries, stainless steel crown, and for anterior, the aesthetic preformed crown. Under that, you should know how a strip crown looks like. What are the different salivary factors and its effect on dental caries, atraumatic restorative treatment, what is vital pulpotomy and what is non-vital pulpotomy, and what is caries risk assessment. Then lastly, diseases of child. So under that, you have to again brush up the developmental abnormalities, the syndromes of the child and how it presents, what is intrinsic pigmentation of teeth, and dental management for a special child. How do you modify the dental management? Thank you.